Hello, my name is Brittany Ricky, and today I'm going to be doing the fetal pig dissection with the skeletal, muscular, nervous, and endocrine systems. So first I just have my setup, and it's a little bit difficult to show you the whole setup just because I'm by myself, but I'll just kind of give you a quick look around here. The only thing I have up on my laptop is the features that we are going to be discussing today. So I'll bring this back over here. I'll do my best to show you everything clearly and relatively quickly. So first, the exterior of the pig, we're just going to go down the list. We have the head region, the neck region, we have the trunk region, which is here, we have the tail region, and then I determined that the gender of the pig is a male. Before I took the skin off, I could see, and you still can see, the urogenital opening, which is posterior to the umbilical cord. And then also I could see the scrotal sac, which is ventral to the anus. Moving on, we have the exterior. First we have the axial skeleton region, which if I flip it back over here, that would consist of the skull, the vertebral column, which is the spine, and the thoracic cage, which are the ribs. Moving on, we have the appendicular skeleton region, which those are the bones that connect to the axial skeleton region. We have the humerus, we have the femur, and we have the tibia. Joint capable of flexion, we have the neck, we have the shoulders or the front arms, and we have the legs. Moving down to the internal, which I'll try to move a little bit closer. So for the internal, make sure I'm not missing anything, we have the pectoralis major, which those are kind of like your chest muscles. Those would be on both sides here and here. Next, we have the latimus dorsi, which is below basically the shoulder and the arm here. We have the deltoids, which are behind the shoulder over here. We have the rectus abdominis, which are your abs, and the transverse abdominis, which are below the rectus abdominis. Next, we have the gluteus medius, which is the butt muscle over here. And then moving down for the nervous system of the fetal pig, the first question is, did you notice covering on the spinal cord? Yes, I did. It is a tough layer that covers the spinal cord, and it's known as dura mater. It's basically essentially a covering to protect the spinal column. The difference between white and gray matter, both gray and white matter are types of nervous tissue. Gray matter is deemed gray because it is dull in color, and that's due to the significant amount of myelin that it contains, where white matter is known as white because it is bright and pearly, and because that has a significant amount of myelin. Moving on, explain how insulin regulates glucose levels in the blood. As a person ingests certain foods that contains carbohydrates, they are converted to glucose. In instances where there is a significant increase of glucose in the bloodstream, there are signals sent to the pancreas to secrete insulin to balance everything out. The insulin works as a force to remove the glucose from the bloodstream and into the cells to lower blood glucose levels. Lastly, what is unique about the glands of the endocrine system? The glands of the endocrine system are unique because they secrete hormones throughout the body that act as a chemical messengers which help keep the body balanced. And that is all I have for today.